A dental hygienist is a licensed health professional who supports people's health and well-being through oral health promotion, education, prevention, and therapeutic services. Dental hygienists work in a range of settings, for example, in general and specialized dental practices, and also in hospitals, nursing homes, and public health or free clinics. Services provided by hygienists include history and assessment of oral health conditions, oral cancer screening, head and neck inspection, dental charting, and taking blood pressure and pulse, and taking, interpreting, and developing dental x-rays. Dental hygienists clean teeth by removing calculus and plaque from tooth surfaces, and prevent oral health problems by applying sealants and fluoride treatments on teeth. They also may make impressions of patients' teeth to be used by dentists to evaluate patient treatment needs. Additionally, dental hygienists teach patients oral hygiene strategies and counsel them about nutrition and health behaviors, including tobacco cessation, and their impact on oral health.
As a dental hygienist, I focus on the important aspects of dental care, and I try to help you prevent oral disease. There's been a lot of research that has shown that inflammation in the tissues surrounding your teeth can be related to a number of different very serious health issues that might have implications to your heart, to a pregnancy, and many other chronic severe illnesses. Now, this might sound crazy, but a few weeks ago I saw one of my patients he has diabetes and he had gotten very sick. He wasn't responding well to any medication, and he actually ended up in the hospital. And when I went to go see him, I asked him to open up his mouth, and it turned out that he had a raging infection. When I later asked him if anybody had ever looked in his mouth, he said no. Now, this man nearly died. I remember the time a few months ago when I saw Pat, and it must have been before she broke her ankle, and I think it was before she was diagnosed with diabetes. Now, we started, as we always do, by reviewing her medical history, and she got a little irritated with me, which on the one hand, she's absolutely right. It can be very redundant. But on the other hand, reviewing the medical history is one of the most important ways that we communicate with each other. I can get a lot of information from her during those discussions.